Cancer is a devastating disease that comes out of nowhere. People diagnosed with it often notice very few symptoms and do not take them seriously. Signs or symptoms of cancer may go unnoticed and hence ignored. In such cases, you need to make sure to notice anything that could be a symptom of cancer. You need to talk to your doctor and get it checked immediately. The disease is easier to treat when you spot it early. These signs and symptoms are signals that something is not right in the body. This article will let you know what the early warning signs of cancer are. Here, we have listed some of the commonly noticed early warning signs of cancer. As a cancer grows, it will begin to push onto the nearby organs, blood vessels and nerves. This pressure will cause some of symptoms of cancer to occur early. So, continue reading this article to know about the early warning signs of cancer. Blood in the urine. When it shows up in your pee, blood could be a warning sign of a problem in your urinary tract. Kidney or bladder cancer can cause this symptom, but it could also be due to an infection, kidney stones, or kidney disease. Skin changes. Variations in moles and skin pigmentation are most often linked to skin cancer. However, different skin changes can indicate other types of cancer, too. If you notice increased hair growth, you could have adrenal cancer. Pancreatic cancer can manifest in the form of jaundice, or the yellowing of the skin and the whites of your eyes. Jaundice can also indicate liver cancer. Bumps in the mouth or tongue, bumps that occur inside the mouth, gums or throat in white color must be checked immediately by a healthcare professional. This is one of the signs of cancer that most people ignore. Chronic cough. A chronic cough or chest pain usually indicates a common infection like bronchitis or sinusitis. If the symptoms persist longer than a month, they could indicate a more serious disease. Leukemia and lung tumor symptoms can mimic a bad cough. If you produce blood in coughed-up mucus, see a doctor immediately. It could be a sign of lung or neck cancer. Blood in the stool. Cancers can bleed, but so can a bunch of other things, like ulcers, hemorrhoids, infections, or a sore. When you see red in your poop, the blood is often from somewhere in your GI tract, meaning your esophagus, stomach, or intestines. One way to tell where the blood is coming from is by how light or dark it looks. Bright red could mean the bleeding is in your rectum or the end of your intestines. A darker color means it may be from higher up, like a stomach ulcer. Cramps or a frequent upset stomach. If you're experiencing cramps or a sick stomach, you may be exhibiting early signs of colorectal cancer. See a doctor if you notice persistent stomach cramps or are suddenly, frequently nauseous. Gas, indigestion, cramping, and unexplained stomach pressure can all signal ovarian cancer, too. Pain and cramping in the pelvis can be linked with leukemia, which enlarges the spleen. Fever. Fever is very common with cancer, but it more often happens after cancer has spread from where it started. Almost all people with cancer will have fever at some time, especially if the cancer or its treatment affects the immune system. This can make it harder for the body to fight infection. Less often, fever may be an early sign of cancer, such as blood cancers like leukemia or lymphoma. Indigestion and difficulty swallowing. Dysphagia, the term for difficulty swallowing, is the most common sign of esophageal cancer. The AX explains you may be unknowingly adapting to dysphagia and ignoring early signs of throat cancer. When swallowing becomes harder, people often change their diet and eating habits without realizing it. As the cancer grows larger, the problem can get worse. Unexplained weight loss or gain. According to the AX, many undiagnosed patients unexpectedly lose 10 or more pounds as the very first sign of cancer. As cancer cells begin to attack healthy ones, your body may respond by losing weight. Weight loss is prominent in cancers of the liver, esophagus, lungs, pancreas, and stomach. Conversely, ovarian cancer patients report unexplained stomach weight gain or bloating. Itchy skin. The body treats cancer as a bacteria, hence the immune system will fight against it initially. This will increase the blood flow to the area, causing the area to be warm and itchy. Extreme fatigue. It's one of the most common cancer symptoms. We're not talking about a normal type of tiredness here, it's exhaustion that doesn't go away. If changing your activity level or getting more sleep doesn't make you perk up, see your doctor. Persistent headaches. Brain cancer isn't often on people's radar like other cancers. But experiencing frequent headaches that don't get better with treatment, as well as clumsiness and muscle weakness, indicates just that. An abnormal growth of cells in the brain. This cancer involves treatment in conjunction with neurologists, oncologists, and neurosurgeons.